proud of, and I want to really applaud all my team for that good work. These are milestones. Most of the hospitals in the world will not be able to separate this or to do this type of operations. So for Kenyans, we are happy, and we want to urge parents, if you get conjoined twins, don't condemn them. Just bring them. We have a number still in the facility. We are buying time. Some of them we have to buy time, but we are happy that so far that the conjoined twins are safe. They are in ICU at the moment. So we thank God, and I really once again, I want to thank the team and also the board and the Ministry of Health for the support they've given us to be able to do such a complicated operations.
And indeed, what the CEO has said, we are very grateful and happy to reaffirm our position as a tertiary institution, level 6 referral specialist hospital. Our special position and relationship with the University of Nairobi is actually putting us at the helm of medical practice, and we are reaffirming our role by this achievement. Really, what I would want to emphasize is the fact that the multidisciplinary approach we have established in this institution, our expanded services in terms of critical care services, not only for adults, but also for children, are yielding fruits. So we want to thank the government and Ministry of Health for enabling us to have these facilities that have actually enabled us to carry out this sort of specialized, complicated surgery, but with a very good level of success.
Brief history about the Siamese twins is that they were born in Bungoma, and as is the referral system in this country, as is the level 6 hospital, it's our mandate to carry out those kind of management of patients of those magnitude. So the patients were referred to us, and first when they arrive here, what we do first is to examine the children and carry out a thorough investigation to understand how the twins are conjoined, so that once we know what it is that is making them joint, we are able to set up a management program and carry it out to conclusion. So when the kids arrived here first, they were received by our neonatology unit, who first of all had to stabilize the babies and take care of them before we commence the investigation. And it's at that time when they were received that it was noted clearly that they were joined at the chest and the abdomen, that the kids were also requiring oxygen to breathe properly throughout. So that meant they were to be admitted in high dependency units. And in the high dependency unit, when we saw the children, we needed to do investigations. And this is where the specialized department of radiology comes in. We're able to take the x-rays and spatial images and be able to understand the nature of joining of the two kids and how the other systems were working. So it's at this point when we understood very clearly that these were two kids, two boys, joined at the chest and the abdomen, and that in the abdomen they were sharing one liver, both of them. Then in the chest, each one of them had a heart, which were enclosed in one chamber. And not only that one of the twins had multiple holes in the heart, and the other one had abnormal blood vessels, large abnormal blood vessels emerging from his heart. So in general, it made us to be dealing with two kids who had abnormalities in the heart independently. They were joined in the abdomen. Of course, that means apart from the liver joining the two, the muscles and the skin was being shared. And by further analysis by the cardiology team on the heart condition, it showed that one of the kids had pulmonary hypertension. In other words, a lot of blood was flowing through their lungs. and that provides an immediate challenge to this kind of kids. So through the expertise that we have in those departments, we were able to manage that blood pressure. But it meant that sooner or later, and more often soon, we had to separate those two kids because those two hearts require surgery. And being joined at the abdomen, the access to those two hearts would be difficult. So we'd have to separate the two, and then each one of them would have to be dealt with individually.